Welcome to CMM Off the Page, a podcast brought to you by CMM Magazine, a brand of Care Choices Limited. Guest speakers will equip listeners with take-home advice to support best practice in the social care sector. The podcast is available to listen to on Spotify, Apple Podcasts, and to watch on the CMM website. We hope you enjoy this latest episode.
As the UK's #1 provider, Moneypenny is the leader in outsourced calls, live chat and more. We handle over 20 million customer conversations each year on behalf of thousands of businesses. Our 45-strong specialist healthcare team is dedicated to looking after calls and chats for the health and care sector, including leading care home networks and providers.
Hi and hello and welcome everyone to CMM Off the Page. In today's episode, we will be discussing the social care workforce with reference to Skills for Care's latest report, the State of the Adult Social Care Sector and Workforce in England, which was published in October. Many of you in the sector will have come to rely on Skills for Care's data insights, obviously lots of training opportunities and guidance supporting providers. And Skills for Care's vision is really to, for social care to be, is a fair and just society where people can access the advice, care and support they need to live their lives to the fullest. And here today to tell us more about that and the report is Oonagh Smyth, the Chief Executive of Skills for Care. Welcome, Oonagh, and it would be lovely if you're able to introduce yourself to our listeners.
Thank you, Olivia. Yes, I am Oonagh Smyth and I'm the Chief Executive of Skills for Care, and we are the strategic workforce development and planning body for the adult social care workforce. Prior to starting this role just in March 2020, I was working in MenCap for about 8 years or so, social care was not new to me.
Brilliant. Yeah, thanks so much, Oonagh. I look forward to hearing your reflections very shortly. And obviously we're thinking today about how can providers use these findings in the report to help them and support them. So it's wonderful to have Angela Farrow with us today, and also Dave Wint, who are both registered managers within care settings. So welcome to the podcast, Angela and Dave. Would you like to share some background about your organisations and also maybe share what motivates you to work in this amazing sector? Angela, maybe you'd like to start us off.
Thanks, Olivia. Yes, I'm registered manager in domiciliary care. It's a private domiciliary care organisation called Home Instead. And what motivated me to get involved in the first place, I just slight background in history. When I was living in Australia, I was a practice manager at a medical centre, so I was familiar with private healthcare. And when I came back to England, the company that I was working with, the director there, their family were having some extreme difficulties in securing good quality care, and they went through a horrendous time. And eventually they came across a Home Instead franchise where their relative lived and thought, great, there actually is an alternative, and so many people don't know that an alternative is available. And long story short, 11 years ago we opened a franchise in the Leicestershire area, of where I continue to be registered manager, and I'm also the network chair for Leicestershire and Rutland, which is the support organisation that's facilitated through Skills for Care, funded by the DHSC, and that's wonderful to be able to support other registered managers in the area. What keeps me in the sector is my passion for getting professional recognition for social care workers. I think they're so undervalued and underappreciated, and we absolutely need recognition for that. And I think Skills for Care is our great vehicle to get that done.
Brilliant. Yeah, thanks so much, Angela. Yeah, I know the National Care Forum are quite keen to use the word care professional. I've heard that term quite a lot. I think they said one thing that we can all maybe, I suppose, to help that public perception. But I know Anna as well will certainly be sharing and telling us more about how we, hopefully can change public perception of social care with their campaigning work. And Dave, would you like to introduce yourself and to our listeners?
Welcome everybody. I'm Dave Wint. I've been in care over 20 years. Originally time served joining the building trade, and I lost my fun with that really. And I know it sounds very glib, but I did want to make a difference. And I started off at Portland College, outskirts of Mansfield, working with supporting students with physical and learning disabilities. Then went on to work for Leicester Housing Association in domiciliary care setting, assistant community manager. Joined the Oaklands 14 years ago now, and I started off as deputy manager, moving on to quality compliance manager, and I've been registered manager for 9 years. We're comprised of 20 bedrooms. We registered for younger adults with learning disabilities. We've got three bungalows. And we've got one set-aside respite room or short breaks, some people term it. We've also got his own activity centre that doubles up with supporting the community. So we run a dementia group once a month, run a little Acorns for a staff team, and it's thriving. We're currently rated outstanding. Well, it's a few years since we've been inspected, once COVID reared its ugly head. But I remain passionate. And we run it as a family, and it's just a lovely nurturing environment for staff and residents alike, really.
Brilliant. Yeah, fantastic. That's quite the career change there.
It was.
Fantastic. Yeah, brilliant. I look forward to hearing your insights and Angela's as well very shortly. And finally, we're very fortunate to have Oonagh with us, Oonagh Severwright. Fantastic that Anna's able to join us today. Anna's a real champion for social care and has direct experience of drawing on care as well. We've already mentioned the social care future movement briefly, which Oonagh is part of, and yeah, it'd be great to hear more about that later on. But yeah, Oonagh, I wondered if you wanted to introduce yourself to listeners who I'm sure many of them know who you are, but for those that may not have done.
Hi, thanks for having me. Yes, so I'm Oonagh Smyth. I'm one of the conveners of a movement called Social Care Future, which is a social movement of people really that wanted to see a change in social care. And as you say, I'll tell you a bit more about it later, but we've just celebrated our 5th anniversary last week. So that was a really good time. And in my own life, I am someone that draws on social care for over 10 years now. I've been employing personal assistants due to being disabled. And if we're talking about our past careers, I actually trained as a doctor and worked briefly as a doctor. So that's what I did before I sort of moved across into this into social care world. But, yeah.
Brilliant. Thanks so much, Oonagh. Fantastic. Yeah, so Oonagh, I think we should come to you first, if that's okay. Now, the report obviously is on the Skills for Care website, and we don't want to overwhelm people with all the statistics, but it'd be great to hear your, I suppose, very brief summary of those findings, and ones that you think that our listeners should be aware of today, and also drawing on some of the positives, because it's not all doom and gloom, is it? There's some positives to learn from that, so it'd be great to hear that.
I promise I won't do death by statistics.
Yeah.
There's so much in there. I would encourage people to go and have a look. It's not just the report. We do a load of infographics as well, so they're more accessible and broken down to an ICS level and a local authority level, so people can just play around with some of that. And just to set a little bit of context, the data comes from half of social care employers who fill in the adult social care workforce data set, so about 600,000 individual records. So it's incredibly robust, and we couldn't do it without employers filling that in. So just a thank you. We're very lucky to have this data from all of my conversations internationally. We are the only ones that have this level of information on the social care workforce. And the report that we published on the 12th of October really gave a sense of some of the green shoots that we saw last year, but similar long-term trends that we need to be picking up. So the the good news, I think, is that social care still remains a really, really popular role. People love working in social care. We manage to recruit every single year 440,000 new people come in to work in social care. So that's more than the size of Bristol. And so sometimes we hear this narrative that social care is difficult to attract people to. Well, it's not. It's actually, we attract an awful lot of people. We need to keep them. So in each year we lose about 390,000 people will leave their roles. Now 2/3 of those will stay within social care. They'll just move around within social care, and 1/3 will move out of the sector completely. And so the report this year has really focused on how we retain the really good people that we have, who have the right values and who are really committed. And we draw out some new insights from the report that we've been able to get through data science, which looks at 5 key variables. And if all of these are in place in a positive way, turnover is about 20%. If none of them are in place, it's about 48%. So a massive impact. And those variables are, they probably won't be a surprise. If you pay over the minimum wage, if people aren't on 0 hours contracts, if they can work full time, if they are developed, and if they have a social care qualification, all of those things make it much more likely that people will stay in the sector. So we look quite a lot at the at workforce capacity, and particularly around turnover. The one thing I did want to say is that we often hear of social care as being positioned as a drain, and actually what we know is social care not only helps people every day in all of our communities, but it's also a really significant economic contributor. So what we have calculated is that social care adds about £56 billion to the English economy every year, and that's huge. It's a bigger workforce than the NHS, makes up about 5% of the total workforce in England. And so we shouldn't be shy about talking about the strengths of social care when we think about that workforce of the future, which I can give a sense of maybe later in the conversation.
Brilliant. Yeah, no, thanks, Ian. I think you spoke in your summary of that report around, like, an opportunity, and sort of how we refrain, like how we plan for the future, and how we actually see it as an opportunity. So I think that's a nice hopeful message, isn't it, to sort of build on.
Yeah, I mean, by 2035, we're going to need an extra 440,000 people working in social care, if nothing else changes. And I see that as 440,000 opportunities to work in a brilliant role. We have to make sure that they are brilliant roles and that people are really valued. We need to make sure that happens. But it's a fantastic opportunity.
Definitely. And Dave and Angela, I wonder if we come to you first. In terms of, obviously, you've probably studied this data and information and the report and the infographics. I suppose, how would you say this report has helped you in your organisation, in terms of your planning and your
I think it's a really nice report. It's well written and easy to digest in the sections. It's quite easy to pull out the particular statistics that are relevant to you, and I think it's great that it has a positive side to it as well. The 5 areas that Oonagh was referring to are really valuable, I think, to focus your attention on those. There obviously, social care is not one thing. There are lots of areas of it, and we particularly work in domiciliary care. We also work with a client focus rather than a worker focus when we're doing our rotas. So one of our main things is what time does the client want to have their visit. So for this reason, it means that we need lots and lots of workers who are available to work in certain blocks of the day. All the people that want to get up in the morning, they don't want to be having their breakfast and shower at 11 o'clock in the morning. They all want those earlier times, which means we're a very high part-time worker focused business. So We do have some people that we're able to offer the full-time roles to, but the majority are part-time. But there are many other things that we can focus on, you know, over recent years, offering a variety of contracts to people. We did find, strangely enough, when we offered contracted hours out to all of our workforce, quite a high percentage were still happy with the 0 hours. But I don't mind that as long as they're happy with it. And I think this move towards that has, you know, if you go back a few years, it was a full, well, social work, 0 hour contracts, nothing guaranteed, can't plan your month, all that kind of thing. You don't hear that so much now because many more are moving towards contracted hours, even if it is a sort of a 16-hour contract, for example, but it means people can plan their income reliably. So yeah, I think those 5 points to make sure that we're always covering that is really good. The fact that they can get this data, that the data set is really valuable because Skills for Care are in a unique position to be able to collect the views of so many different organisations. I think it was mentioned somewhere like 20,000 providers have contributed to this, and that often wouldn't happen because I remember last year we had a piece of work we were asked to do on the fairer cost of care, and it was a massive piece of work and it took a lot of time to do, and it actually went nowhere. And you know, government sort of back off a lot from that, whereas with this data set here, we were first attracted to it because of the Workforce Development Fund, that we were able to get assistance for training our staff. And so very early on, that was why we first started entering the data into it. And then gradually, as it's been taken more control of and has expanded into those benchmarking things, it encourages you to have much more. And certainly if you're a small provider and you don't necessarily have a lot of resources, you know, it's good to be able to collect all your workforce data in there. And of course, it means that the information that's collected is meaningful because it's come from such a broad source, from small independent providers to big organisations. So yeah, I was quite impressed with it.
Brilliant. Yeah, thanks, Angela. That's a good recommendation.
And I haven't even paid Angela to say that or anything.
not so much as a packet of biscuits.
Is that a hint there, Angela? Brilliant. Yeah, that's really
good. You what, in care work, we never turn down a packet of biscuits.
That's true. Any firm favourites?
Bourbons.
Okay.
In fact, funny thing is, you know, we do that in one of our things we do say to our care staff when we're doing our interview. You know, what's your favourite then? A chocolate digestive or a hobnob? Almost like how do you like your custard, for how people like things.
Oh yeah, well yeah, I'm sure you're aware of the recruitment guru that is Neil Eastwood. He's always keen to you should find 3 things out about each individual employee. So if that's one of them, you can pop a packet of those on their desk on the first day. That would be
absolutely
excellent retention idea. Yeah. And Dave, yeah, it'd be interesting to find out, you know, some of these areas of the report as well, and maybe actually some of the insights and trends that you're experiencing. Are they similar to Angela?
I just find it really interesting reading. You know, it gives overview of recruitment, vacancies, retention issues, the demographics. I was intrigued when I found that the social care contributes 55.7 billion to the economy, and you know, then I thought about it and sort of looking at the Oaklands. We're based in Warsaw, which is an ex-mining community, and actually the Oaklands, we employ 45 individuals, including myself, and we're one of the biggest employers, you know, in the area. And then looking around, I've got colleagues in, there's 3 or 4 different care homes also in Warsaw. There's a lot of domiciliary care amongst Warsaw and Mansfield and Ashfield and all around there. So we're contributing a hell of a lot, aren't we? And, you know, share the frustrations of when, you know, the lack of kudos that I think social care is held in. You know, you hear, well, they're just a carer. They're just a carer. Well, excuse me, you know, from the second that anyone comes into care, they're starting off with the induction, the care certificate, and you never stop learning. It's a constant journey. And we aren't dealing with commodity. We're not dealing with bricks. We're not dealing with tins of beans. And, you know, I set a lot of store in Skills for Care, and I will say that, the training initiatives that, we can tap into, part of the registered managers network and find my local network, just so informative all the time. Looking at the 5 sort of retention factors, you're looking at the minimum wage. With us, I've tried to sort of look at how we address each sort of area really. So, we pay above the minimum wage, but as well as staff have additional increments in the pay, depending on the individual roles and qualifications. So, like there'll be seniors, medication leads, activity, outings coordinators, so, they get the increment. Not having 0 hours contract we're a little bit on the fence with that, because we employ bank staff. And it's their choice that they're on 0 hours contract, because they can then give us the hours that they actually want, and it works for them. And they value just as much as someone that's on a full-term contract. They undergo all the training. They have the same respect. If they're confident and competent, they run a bungalow on their own. They can take the lead with running that bungalow. So there's no differential. So I think 0 hours contract it's a double-edged sword, really. It suits some people. We have a lot of people that want full-time contracts, if they're applying for mortgages and everything, and we facilitate that. Another point was being able to access training. Everyone at Oaklands will have a full induction. Everyone completes the care certificate, whether they come with qualifications or not. And you might find that a little bit strange, but what it does, it refreshes their knowledge, and it embeds the Oaklands way of delivering care, in the way that we want to be doing it. We'll have the buddying system, we'll have mentoring system, with supervision, so everybody's supported, and everyone has relevant qualifications. I love the statistics that you can, the comparisons, and the Oaklands, we're 88% of our staff team are level 2 or above, compared to the statistics that were 54% on average, and the others, the other percentage actually working towards that. So that's really good. Just an aside though, besides those 5 main factors, I actually asked some staff members at dinner time, having a sandwich, about what they considered the biggest draw to retaining their services. And it's I don't know if any of you have heard about from Neil Eastwood, his recruitment.
Yeah.
Yeah, and I've been on quite a few of his courses, and it's almost the soft things that people. And so my staff team, they're saying, well, it's nice to be being valued and appreciated. It's nice to feel supported, by the peer group, by the managers, by the residents. They say we're very much family orientated sort of business, really. Being thanked, we all want to be appreciated, don't we? It's I don't mean sort of glib thanks, but we all need to.
It goes a long way, doesn't it? Yeah,
genuine appreciation. We're also flexible. If someone's got a health appointment and they need to nip off the blood test or whatever for an hour, I say, we've got sufficient staff in, off you go. And I'm a big believer, you reap what you sow. So next time you need to call in that favour, the more likely to do it. It's very much a two-way street. You're reaping what you sow. They wanted a happy, safe environment. I know during COVID, the feedback from the staff team, as harrowing as it was, I won't wish it on anyone. And anyone working health and social care, it was just horrendous, wasn't it? Yeah, but they told me that they felt safe and they felt supported coming to work, which was fantastic.
Yeah, that is really great.
And we have fun, so there's a lot of soft factors, built in with those statistics. I don't think it's just those 5. I think it is creating a caring, nurturing environment. But the report, it really nails it, and I just think it sort of puts the emphasis, on really we should have a lot more respect for the roles that we all do.
Fantastic. Yeah, thanks, Dave. Yeah, and impressive training statistics there from you as well. And I suppose you could do you use that for your evidence, for the CQC and.
Yeah, and this is another great thing about it. We share it with CQC, we share it with the Notts County Council, And I'm a big believer, if you're doing something well, then, let's evidence it.
Shout about it. Yeah.
If you've nothing to hide, then, I think it just gives that another level of transparency to our service.
Great. And Oonagh, did you want to come in on Dave's comments there?
Yeah, I just want to pick up 2 points. One is on the 0 hours contracts, and I agree with both Dave and Angela. For some people, 0 hours contracts really fits in their lives and they want the flexibility, but it's often dependent on where the control sits. So if people want more stability and they have to go on a 0 hours contracts, that's where the issue can be. So it's the balance, I think, between when those 0 hours contracts are reality. We have about 16% of providers who have a turnover of under 10%. And when we did some research with them, it's really aligned with what Dave was saying. And we asked them, what is it that you do that keeps people so long? And these were large providers, medium, small. There was no. They were all completely diverse. And what they said was that it's about living your values. It's about involving people in decision making, saying thank you, and feeling valued. So that this isn't the 5 factors that we've pulled out are just the ones that really jump out in terms of the statistics. But there are a lot of other factors in there, like how close people live to their work, their manager, if a manager leaves, your turnover increases. So there's a lot of other factors there. But our sort of takeaway is it's about quality of role, it's learning and development, and it is absolutely organisational culture. It's so important.
Yeah.
Brilliant.
Another thing I found really interesting was the factors affecting CQC ratings. So and it really, when you spell them out, it's common sense. But low staff turnover, the better CQC rating. Yeah, I think that's probably because the employees taking pride in the organisation and the care delivery. The higher the staffing levels, the better CQC rating. We all need a safe service, don't we? We don't be running on a shoestring. And higher pay for care work is associated with better ratings. You've got to pay people for the skill set that they've got.
Yeah.
I think up to take a care certificate. That's why we're so keen to promote it in house, and everybody buys into that. And better training. I think if you consider the cost of training expensive, what's the price of ignorance? And it's very much you've got to be trained, you've got to be confident, and you've got to be competent.
Fantastic. Yeah. So Oonagh, I think we spoke about we're going to talk about in the interim what providers can do to sort of combat some of these challenges, and you'd say like that feeling of feeling valued, training. They would be the key areas there that providers should be thinking about.
Yeah, it really is those 3 areas. It's the quality of the role, and that's pay, terms and conditions. We look at things like statutory sick pay. If you pay more than statutory sick pay, more than the minimum pension, that has an impact. So really quality of role, learning and development, and people feeling developed. And then organisational culture. So that's, we're doing quite a lot of work around compassionate leadership and equality and diversity. We've got a very diverse workforce, but that doesn't necessarily translate into leadership roles. So just thinking about organisational culture. So I think if providers focus on those 3 broad areas, that'll have a massive impact on keeping people, really.
Definitely. Yeah, definitely. And Anna, I just want to so obviously the report does touch on data relating to individual employers and personal assistants, and I just wondered why, from your personal perspective, why is data on this so important, and how has it helped you?
I mean, I think it's very important just so that obviously we can spot trends, we can see where there are potential, needs for intervention from policy planning perspectives and things like that. I guess as an individual, it's more a sense of, it's nice to know I'm not the only one, in a sense. Actually, like, there's lots of other people out there doing the same thing. It's fascinating for me. I suppose I don't use it in the sense of, I don't have a large organization that I'm trying to plan my, I don't have a HR department. But I think insights are really interesting as well, those 5 things, because some of them I definitely do. I pay well above the minimum wage. My PA's at the minute, I think, I'm £13.70. And I can do that because although I cost the local authority less money per hour of care, I don't have any of the output costs. You know, I don't have an office, I don't have like managers and things. So I suppose I could pass more of it on to the A. But I guess one issue I have is like I don't have a way to progress them. So I have had PAs stayed 7 years, 5 years, but they've gone on to work in other sort of roles within health and social care. There isn't I can't promote my PAs, which I think is an issue for individual employers, and trying to work out a way to do that. You know, I've not found a way to do that. I agree with Dave around the 0 hours contract. Technically, mine are on a 0 hours contract, but I don't think I've ever said to anyone, you know, you must do this tomorrow at these hours, and if you don't, you know, you're sacked. And generally, it's a total negotiation. So currently, one of my PAs, you know, she comes to me, she drops her children off, she comes to me for 9:30. So I know I'm not going to be able to be somewhere at 9 a.m., but that's okay because I can plan my life around that.
Yeah.
But equally, there are times when, you know, she came with me last week to Manchester for 3 days. So obviously she'd sorted childcare and done, you know, so, but we work it out. I can be flexible for her. Sometimes she says, oh, I need, you know, could I finish early to go to my kids' assembly? You know, so it's that sense, I guess, as an individual person, I can be fairly flexible, but obviously that has impact on my life as well. So it's an interesting thing, and seeing the differences between different types of the sector. You know, it is such a broad, everyone talks about social care, but actually such a broad sense of roles that it's useful that I'm glad personal assistants are included, because I think often they're not really thought about in the wider, you know, world. When we talk about social care, a lot of people think about residential care, think about carers in uniforms, but actually the whole nother side of it.
Yeah, no, thanks, Anna. Yeah, I think, and you kind of mentioned a few points there, but for other individual employers who are looking to, you know, retain, obviously you mentioned that you're sort of working out how to do that without the career progression pathway, but I suppose, you know, it's being open, being flexible, having those open lines of communication, and just, you know, having good conversations, I suppose.
It's definitely got much harder in the last few years. Even people are saying to me who've been employing PAs for 30 years are saying they've never known it to be so hard to recruit. And I think where before I would get sort of 20 CVs, I'm getting 1 or 2. So it's then you're sort of going to compromise sometimes on who you employ, because so much of it actually, it's not about skills. So where I differ from Dave, I don't ask for any qualifications. I don't put people through any formal training. And actually, if I see that they say on their CV that they've worked in care before, I'm more hesitant. Like, it makes me nervous because I don't want them to come and go, oh, I know how to do X, Y, and Z. You know, I had one once, she didn't last that long, but she came in and, you know, she's like, I'll get you your breakfast. And I was like, I don't eat breakfast, but thanks anyway. You know, like, why would you get me breakfast? You know, so it's the sense of actually I train them. It's more about learning my life. And so for me, it's very much around values. It's very much around understanding that the role is not about looking after me. It's about supporting me to live my life. And I think that is the key for me. So once I find somebody from whatever walk of life, and I've had all sorts of people, from photographers, teachers, anything, but once I find someone that gets that, then that's brilliant, and I will do everything to hold on to them for as long as I can.
Thanks. No, thanks, Anna. That's really good. I think that's really, explained it really well for people as well. And I think that it comes back to that perception, doesn't it? And, you know, the question around, you know, public perception and knowledge around the role of a personal assistant as well, which might be probably part of a much wider, you know, government recruitment drive and things like that. Dave, I see you've got your hand up there.
Yeah, it's interesting what you say about the sort of selection process, and it very much mirrors my own, really. A few years ago, I sort of wanted everyone coming qualified, you know, some sort of care qualification. And what I found was that they came with so much ingrained bad practice. It's almost like learning to drive and all these bad habits, haven't you? And institutionalized viewpoints. And what I find we do now is we recruit on soft skills. You know, so it's, you know, it's values-based recruitment. You know, so if people are, you know, if they come across as honest and they come across as caring, we can do the rest. You know, in fact, I'd rather sometimes have a blank canvas, because you can teach them the correct way, can't you? They're not coming with all these preconceived ideas. And I was actually going to ask you, do you sort of train your team and such like? Yeah, I'm thinking in the basic sort of skills. So it was interesting listening to you thinking.
Yeah, I mean, even for me, it's basic as like how I prepare food in the kitchen. Everybody has a different way, don't they, of what they like and how you, and it's that sense of just coming in willing to learn and willing to adapt to my ways of things. I mean, again, I adapt to theirs as well to an extent, but we all know we have things in our home that we're in a certain way, and if someone comes in and starts doing it differently, you'd think, why are you doing that? So yes, it is a blank canvas is perfect. I agree with you, Dave.
Yeah.
Great. And Angela?
Yeah, absolutely. It's very much the way we recruit. I wholly understand what Dave's saying about, the double-edged sword of somebody coming in with a lot of qualifications, because they can also come in with the attitude of I know everything, you can't tell me everything, and we very much same view with putting everybody through the care certificate, because it's how Home Instead do things that we're interested in, and the way we do things is by respecting the fact that we're going into somebody's home and they're the expert in that home, and it's supporting them in their quality of life. So if they like builder's tea in a mug, it doesn't really matter if it's whether the person likes herb tea in a china mug, or they like their toast like charcoal, or they like warm bread. What do they like? That's what's really important. And you can imagine, I think a lot of the clients that we look after, they have an awful lot of challenges to their independence already, and it must be incredibly irritating for somebody to come in and give them strong tea and charcoal toast if that was an Easter egg mug in the cupboard, and what they really like is their china cup and nice lightly buttered toast. So yeah, those soft skills are really important, and it's what we say when we are interviewing. It's looking for that compassion, that empathy, speaking the language of kindness, because anything to do with delivering care we can teach them. So we have a really good training program and competency assessments and so forth. So we can train people on that, but you can't train people to be reliable and compassionate and empathetic. So they're the things that we're always looking for.
Yeah, definitely, Angela. I did hear someone once actually said that you can train, but I disagreed.
I'm not so sure about that. I think you can make people aware of the importance of certain things and bring on a better understanding of something. But if they don't have it, then by and large they don't have it. And it's crucial. And again, one of the things that's so important, going back to what Dave was saying about talking to his staff, one of the things that shines through in our supervision meetings is how it makes their day when they put a smile on the face of their clients. That great feeling from giving back to the community. And I touched on earlier that a lot of our staff are part-time workers, and many of them are people who have reached a stage in their life where they don't want the pressure maybe of their full-time job, and they're in a situation where they don't have to work full-time, but neither are they ready to do nothing. And this phrase of giving back to society, I think is so important. And we have people on all stages. We have people who come along who think, I wish I'd known this was available when my parents needed care. Similarly, sometimes we have people who come to us earlier and then they leave because their parents then need care, and they say, oh, well, I need to take some time out now and care for my own parents. But that sense of wanting to help, I think is much better now than it was many years ago.
Well, that's good to hear. And I suppose obviously the volunteer armies as well that came about in COVID and the pandemic as well. There's seeing all of that giving back and good work. Hopefully some of that has actually continued through.
And some of it explains, so we are much more likely to get people who want to work in social care if they've had some sort of experience of social care or caring somewhere in their lives before. So that might be a member of their family working in social care, a friend, themselves, or it's meeting people who have worked in social care and getting that sense of the role. And it's why when you do listen to Neil Eastwood, who we've talked about a few times,
Yeah.
who runs Care Friends, but the whole premise behind
Family
that
carers.
is that if you have people with exactly the right values working in social care, then they're more likely to surround themselves with people with similar values, and so then having them recommend the roles is more likely to be a values match for the organisation and the individual, and that just makes so much sense, doesn't it? And sometimes I think we don't do enough to talk about what working in social care actually is. I still read job adverts where we say needs to have some experience or will be doing personal care. Well, I don't know anybody who knows what personal care is outside
Yeah.
social care. When I always say, when I did my run this morning and came back, I didn't say to my husband, "Oh, I'm going to do some personal care." I said, "I'm going to jump in the shower." That's
Yeah,
how we,
yeah.
that's how we
Well,
talk.
yeah, in language, yeah. So there's perhaps some language barriers there in terms of the terminology, and almost, yes, like Angela's talking about, including those soft skills in the job descriptions more so, and making that a bit more of a priority perhaps when
Yeah.
we're recruiting.
Yeah, and just
Great.
explaining what the role actually is in a way that people can understand.
Yeah, that would help, wouldn't it? I think so. Yeah, definitely. And I know we're keen to chat about the ASC, is that right? The WDS. I wondered if maybe you could share for our listeners sort of how that all works, and then it'd be great to hear from Angela and Dave on how they use that and how it helps them as well. So.
Yeah, so the adult social care workforce data set is a very long title for the data set that we hold, and it's basically what allows us to publish the report that we just published. So we use that. We also do a field survey, so of individual employers, because they won't complete the data set, and so we ask individual employers to fill in the survey once a year, which I think is really helpful, and we're really grateful to people for filling that in, and it really gives us a sense of the whole workforce. So some of the data sets will only cover CQC regulated workforce, for example, whereas this covers every single role, regulated professionals, registered managers, care workers, personal assistants, everything that you can think of. Local authorities have to fill in the data set, so we've got basically 100% completion there, so that gives us a really good understanding of the social care workforce for local authorities. But it doesn't just give us data and insight, although it does, and it's really helpful. But you heard a little bit earlier with Angela and Dave saying that it's also provided as a service. So it allows providers to go in and benchmark some of their key headlines against other providers in the area. So I'm in Haringey at the minute. So if I had a dom care agency in Haringey, I would be able to go in and look and see, oh, I'm paying a little bit more than most dom care agencies in Haringey. I'm going to put that into my employer marketing. I've got lower turnover. I'm going to use that to say to people, actually, people stay here longer than most other, or vice versa. I might see, I'm struggling to recruit and I'm paying slightly less than average in the area. Well, that's really helpful to know. And that's really rare, I think, in social care, to be able to get that benchmarking for free. And the service also allows, as Angela said, people to track the training of their own teams and to set reminders. This person's mandatory training is up, and the system will flag that to you. Normally, you'd have to pay for that and buy that in as a separate service, but it's all part of the data set that's obviously free to complete, and that allows you to pull training reports for CQC, for example, if you need to show your training reports. So there's sort of three benefits for the employer. There's the benchmarking, the access to training, but also knowing that your data is being fed into a bigger picture that's used.
Yeah, that's really interesting. I think I was wondering,
Yeah.
I was going to ask, if Andrew and Dave, whether you think providers actually, look at other providers enough and actually their areas as well, to sort of, to reflect on other organisations.
I think it's important that we do look at other care providers. I'm a big believer you can learn from good practice. It's nice to know what we're doing well, and highlight, speaking to the providers, areas we can improve on.
What is quite important is getting people to engage in these things, and I think particularly smaller companies that the manager may be doing many things, and getting them to engage. Their voice is so important to be heard, and I think the fact that as a reward for doing all this, we're able to get contributions to the cost of training our staff. It means we get something tangible back. We can see, well, not even just tangible back, but maybe for some companies, some providers, it can be the difference between being able to put those staff through training or not. That they might not be able, because although there are various grants over the actual funding, there's still a lot of time given on the hours of training and things that they need to do in the course of their work, so that there's quite a lot of investment that the companies have to put into that. So with the Workforce Development Fund being available, that is a massive incentive to people to do. And of course, as Dave said, it's crucial to have all these training records and things available for the CQC.
Especially now with the new
the new regulatory
yeah,
system
exactly,
as well. But even under the old system, you need all those things to get that recognition for your service. We are rated outstanding in all areas, and we have to, under the older system, and like Dave, prior to COVID was our inspection, and things are changing, but those having those statistics and those benchmarkings available just does help you evidence, because it's all about being able to evidence what difference does all this have to your clients, what difference does it make to their life. That's the important thing, and being able to evidence how we do that is well, important.
Definitely, yeah, and well done to you and Dave for those ratings there. It's fantastic. Fantastic stuff. Anna, did you have something to add to Angela's point?
So much to Angela's point. I think all of this data is really useful looking at what we have now. I think Oonagh mentioned earlier about the workforce of the future, and that if we're seeing sort of social care, actually we know with the demographics that actually we are going to need to sort of increase the workforce of the future, and seeing that as an opportunity, and telling that story of social care, that actually if we do it in the right way, these are good jobs that people can have, and we can also see sort of value the role of social care. But I also think that we need to imagine and think about the future differently, and think that we will need the current roles, but we also want different roles. And if we want the social care that's about increasing people's health and well-being, and community, things in the community that are keeping people well for longer, actually what roles might we need? And so it's great we have personal assistants, but actually we might also need more sort of micro enterprises, local area coordinators, circle connectors, all sorts of different sort of roles that will come under the broad blanket of social care, but actually at the moment there's a few here, a few there, and unless we start as a sector, and in the sort of plans I know Oonagh's going to be sort of starting to look at, and I'm sure she'll be thinking about these things because I know her well. But if we don't start talking about actually what roles do we need as well, then we can just look at what we've got now, which is important. But actually, we don't necessarily just want more of the same. We might actually want and need some different as well. That would be my only point. Thank you.
And also to ask people, drawing on care, what those roles should look like, and what they're, which is key. I think that's someone said to me not that long ago, actually, at one of the conferences, whenever we're talking about social care, we should be talking to people who receive social care in those conversations.
And in 20 years' time, who are going to receive social care, and what will they want that to look like? And I think, our lives are very different now to what they were 20 years ago, and they will be different in 20 years' time, but people's expectations of life is looking quite different. And I think we need to start having those conversations now, so we can plan ahead, rather than sort of always be, as is often the case in social care, sort of plugging the crisis and the sort of trying to find workforce very quickly because we haven't got enough. But actually, if we can sort of start those conversations earlier, perhaps we can work together to find some solutions and to make roles that are really diverse and interesting, because actually the more satisfied someone is in their role, that they're really making a difference, then the more they're likely to stay. So I think it's a win-win. But
Yeah, no, definitely. And also, yeah, thinking about that generational change as well, and different demands depending on that generation as well. And Angela, did you have something to add?
Yeah, I think that's really key. You know, what Anna was saying about thinking about the diversity of roles, and also in being able to give people progression. You know, one of the blockers that we find in domiciliary care is that a lot of once you get into the sort of levels of training and qualifications that are available now, they invariably go into management and actually managing people, managing other employees. And there are quite a vast portion of our frontline workers who don't particularly want to be people managers as such. What they would like is more skills and more diverse skills in how to look after and support people at home. And I think as more care at home and more healthcare at home is coming in the future, then more qualifications that support people to have that career progression, but in maybe a more clinical side, you know, more holistic side, you know, whatever, but more diverse things, so that you know, we do get quite a significant amount of people who reach a certain stage and then they go off to be healthcare assistants in the NHS because they don't want to be people managers, but they do want to progress further than where they are. And I think, you know, being able to address that will be a big help to retention.
Yeah, definitely. As Samantha Crawley, actually, from Bracebridge Care Group, spoke on our podcast about leadership, and yeah, I think it's not assuming that everyone wants to become a leader as well. Like, not everyone wants to develop, and I think it's, yeah, sort of looking at each individual and how you can develop their skills. Oonagh, I'm conscious that we haven't really touched on the workforce strategy yet.
It's a
And
perfect segue.
yeah, so, and I just wondered, obviously, you know, general election, not too well, little distance away now, but I just thought if we could, not to go doom and gloom, it's hard not to, but with government and policy and, you know, proposals, and, you know, I suppose also for Anna as well, can add in, you know, what should, you know, you know, a new workforce strategy look like, and also what do you want the government to sort of deliver on to support that as well?
Yeah, so just for the benefit of your listeners who might not be aware of this, but when we launched our report the other week, we, Skills for Care, announced that we're going to lead with partners the development of a 15-year workforce strategy for the adult social care workforce. And that's really because where some of the trends that I spoke about, if you just look at demographics alone and nothing else changes, we're going to need about 440,000 additional roles. And we've got about 400,000 people going to retire in the next 10 years. And we have a lot of vacancies today, as we know. The workforce strategy isn't just about how do we get an extra 440,000 people. We're already seeing some of the new roles, as you know, Anna sort of referred to them, in communities that are popping up. And if we look at, well, what does social care do at its best? Well, it is about personalisation and prevention and well-being, and we don't always have the space to do that. And we have very different expectations today than we would have had 20 years ago. And in 20 years, we're going to have very different expectations. We're seeing those shifts so quickly. So added to the changes in our own expectations, changes in demographics, but also then when we think about technology. You know, I had a conversation with someone the other day who was saying we've got to AI is on its way, we've got to start planning for it. Well, AI is here, isn't it?
Yeah.
And it's not about it's not about planning for it. We need to do it because it's here. And we have an opportunity, I think, in social care not to replace people, because actually social care is about relationships, and that's why all of the stuff that we've spoken about today have had relationships at its heart, haven't they? You know, relationships with the people that we manage, relationships with the people that support us, relationships between each other as a sector. That's the core. But the reality is it's very unlikely we're going to be able to grow the workforce to the extent that we need to, just looking at demographics. So there are loads of opportunities to think about the impact of technology, but also to think about different roles, and that roles that might be exciting to different types of people who might not necessarily have thought about social care before. So roles in data, in AI, some of the tech roles that can meet needs in different ways. So really, I think our attempt at thinking about a workforce strategy is recognizing that the levers are owned by a load of different people in the system. So some national government, some of the integrated care system level, commissioners and local authorities, employers, people drawing on care and support. We can all do our own bit, but we've all got to start pulling in the same direction, so that in each of those levers, we're all trying to do the same stuff. The strategy is intended to look at what we can do within the current paradigm, but to start to say, and what might a new paradigm start to look like, and to start that conversation. But also, we talk quite a lot about innovation in social care, as if there isn't any. Well, there's loads of innovation in it can just be incredibly difficult to get it scaled. And so if we get a few really key areas that we know work, and they're the areas that we say, okay, how do we scale these, and how do we not necessarily move from here to 200 miles down the road in the blink of an eye, but we move to the adjacent space, so that eventually we get to that different place. So I think that's the thinking behind the workforce strategy.
Wonderful. Yeah, no, thanks, Oonagh. And yeah, brilliant to hear that, the passion as well. I mean, for everyone today as well, I think, that's what makes the sector so wonderful as well, isn't it? Everyone uniting and striving for change. So yeah, that's brilliant to hear. Anna, I'm conscious I really would love to hear, I'm sure you'd love to share with our listeners about Social Care Future and your campaigning work. And you've had launched in a very exciting animation last week, which CMM shared. So I wondered if you wanted to tell us a bit about that.
Yeah, thank you for sharing it, because it's a very short animation. You can find it on our website or on Twitter, socialcarefuture.org.uk, and it's 1.5 minutes. And it's voiced by the wonderful Liz Carr, who's been in Silent Witness, and apparently she's in a Marvel series now, Loki too, but I don't know much about Marvel, so that's passed me by. But and it's really just a telling of our vision. So one of the first things we did 5 years ago was co-produce a vision for social care. I think what's powerful about the vision is it doesn't actually mention social care, because it's very simple. We all want to live in a place we call home, with the people and things that we love, in communities where we look out for one another, doing the things that matter to us. So it's really just a vision for life, and it's a vision that everybody, it talks to everyone. It doesn't just talk to people like myself who draw on social care. It's just that perhaps people that draw on social care are often finding that they can't, that aspects of that vision are not are taken away from their lives, or the choices are restricted. And I suppose the reason we did this animation was that we are wanting to talk about social care to a much wider audience. I think we can talk to the sector, and the sector talks to itself, and that's very important, that we are trying to improve things. But actually, most public, or the wider public and the wider media, sort of talks about social care very much they always have that wrinkly hand photo with any news story, which I just most people think it's older people, residential care homes, and on the news at the minute especially, it's always about getting people out of hospitals, and that social care is a problem because it's blocking hospital beds, and people are talked about as if they are a problem, when actually it's not anybody's fault that they're in hospital. That's not their fault, and as a block or a thing to move, to be put into social care. And so we sort of started looking at how you talk about social care in a way that it's about enabling people to live a full and ordinary life. Gloriously ordinary is a phrase that my colleague Tricia came up with, and I think sums it up beautifully. I need a PA so that I can just do the normal things like bake my Christmas cake, or cut my carrots up, but I also want to be able to do amazing things as well with my life. And I think it's that balance, and it's about telling that story. I think that works with recruitment, because actually, you know, some of the things my personal assistants do with me are actually quite, you know, cool experiences, and that they are getting a sense of satisfaction that they're enabling me to do these things and build that relationship. I think we did some research with the public that showed that actually hearing our vision and telling them more about what social care can be did improve their willingness to support social care, their interest in social care, and that they would actually sort of agree to pay more for social care. So I think there is a possibility there to actually say, you know, let's as people that work in social care and are passionate about it, let's actually talk about how wonderful it is, what it can do. Let's raise the aspiration for what it should be, that actually what we have now is for a lot of people not good enough. And let's, whoever's in power next, you know, call on them to be doing this. And let's work together to get there. And I think that's what we're going to try and do. So we're an unfunded movement. We've done a fair amount in our 5 years, but we're now sort of always madly ambitious. So, you know, we want to go out now to sort of the public and have some sort of campaign that will mean that we can say to people, you know, social care is about all of us. It's not just about a group of people over there that you think, you know, actually it's about us all in society, in our communities, living well, living happy lives, contributing. And so that's our plans. So yes, if you want to get involved, find us on social media, socialcarefuture.org.uk, join us. It's, you know, anyone can be a part of it, because it needs us all to do it. It's not a few of us doing this. It's got to be everyone getting involved.
Yeah, absolutely.
There you go.
Yes.
Thank you.
Thank you. Yeah, we're coming to a close now. But you know, obviously, so wealth of resource on the Skills for Care website, and training and guidance, and so much on offer. But I wondered, in just a few minutes now, if there was anything that you really wanted to highlight to our listeners, that they should be, you know, maybe some webinars that are coming up in the next sort of month or so.
Yeah, so there's so many resources on our website. I would encourage people to have a look at. So everything that you can think of around the social care workforce capacity, recruitment, training, and particularly thinking about culture and equality as well. We're doing some regional events over the next few weeks, looking at the equivalent of the data that we've spoken about today, but at a regional level. So what's happening in local areas, and allowing people to explore some of that. We've also been doing a lot of work on new demographics into social care. So we have a workforce that is predominantly female. So we've had a slight increase in the proportion of men in the last year, mostly due to international recruitment. But we need more men, although we do employ twice as many men as the whole of the armed forces in the UK, which I think is an amazing statistic. So we're doing some work around how do we get and keep more men and more younger people into social care. So keep an eye out for some of that. And we've got locality managers in all local authority areas and all regions. So you can just pop that into our website and have a look at who your locality manager is. And there are always events happening locally, registered manager networks, which we've spoken about a few times today. They can be quite lonely roles, and our registered manager networks are really valued. Deputy registered manager networks and networks for nominated individuals as well. As well as the sort of formal advice and guidance and the data, there's also that opportunity to get support from people who are in the roles and you know, can give that sort of moral support, but also really practical support and answers as well. So we're doing loads. So just sign up to our newsletter and have a look at the website too.
Brilliant. Yeah, thanks, Una. Yeah, I'm sure there's lots for people to sort of read, further reading after the episode. So I wondered if anyone had any final thoughts before we closed.
Just to reiterate, really, you know, what we've all said. You know, we're all in it together. I think there's some brilliant initiatives out there. You know, when they get talking to my peer groups, such as yourselves, you know, I think we are pulling together in the same direction. Yeah, I think there's a lot that we all need to be very proud of. And I agree with Anna. We really need to promote, social care. Because it's such a vital role. It's so vital that we get it right.
Yeah, definitely. Thanks, Dave. Yeah. Thank you. Thank you for everyone for sharing your insights and for all the fantastic work that you do in the sector as well. Really great to hear from you all today.
Thank you, everyone.
Thanks very
Thank
much.
you.
Thank you for tuning into CMM Off the Page. Explore CMM's portfolio of content, including daily news, blogs, a magazine, and CMM Insight webinars by visiting www.caremanagementmatters.co.uk. To make sure you don't miss a podcast, follow CMM on Twitter @CMM_magazine and use the hashtag CMM Off the Page to join the conversation and share your feedback. See you next time. CMM Off the Page. Listen, learn, lead.